Hi guys, so today I'm going to be talking to you about suture care and how to care for your sutures. On this specific wound, we had to keep it dry for 48 hours and keep it wrapped for 48 hours. After 48 hours, there was still some blood coming from the area, but the directions were to wash with soap and water once a day and keep covered. One other thing you want to keep in mind when you have sutures is to not soak them, as that can bring bacteria into the wound and make the sutures come up. I'm going to be showing you the materials I used and how to care for the sutures, and then I'll also be showing you after the sutures were taken out and the care for that as well. Okay, let's see. To cover the area, I had to wrap the wound, so I used self-adhesive sports wrap, gauze pads, and some over-the-counter Neosporin. There is dried blood all around the suture area, so the first thing you're going to want to do is wash the area. After it's been washed, you're going to want to apply your Neosporin very generously to the area. Be careful not to touch the area with the tip of the Neosporin, as you do not want to spread any bacteria into the area. Then you're going to cut your gauze pads to shape and cover the wound area that you had just put the Neosporin on. Now that it is all covered, the next step is going to be to wrap the area. So using my self-adhesive wrap that I got, I carefully and gently wrap the area. You're going to want to make sure to close the ends so the wrap does not come off. Then you're going to slowly wrap around, and you want to make sure it's tight, but you don't want it so tight that it's cutting off your circulation. Then as you get to the end, you're going to want to press it together to make sure it adheres together, and you're going to want to cut off the excess band that you did not use. Then you're going to want to take and stretch the end and firmly press it together to seal the end. As you can see, we're all wrapped up, but I still have movement in my fingers. After 10 days, we removed the sutures, and I had to have some skin glue put in place with some sani strips. Now after that, you just cover the area with some finger band-aids is what I used to keep the area nice and dry and clean. The sani strips will fall off after 3 to 4 days. It is important while the sani strips are on to not soak the area, just as the sutures, and to keep an eye on it. You always want to pull your band-aids off the opposite way of the cut. After about 4 weeks, my wounds have fully closed, but I do still have pain in the area. Okay, so I hope that gave you the information you were looking for. As always, thanks for watching. Bye.